want to turn now to another big issue, which is healthcare reform, which I know has been consuming a lot of your attention. Specifically, Paul, you wrote a recent op-ed saying in favor of the Senate healthcare reform measure, and you said those who oppose it fall into three groups. These are your characterizations, not mine. One would be the crazy right. Yeah. Two would be unhappy progressives who wanted more, and three would be what you call the Bah Humbug Caucus fiscal scolds. Now, I don't want to point fingers, but one of your fellow colleagues in the New York Times op-ed page is opposing the healthcare reform measure. I'm assuming you don't think David is a member of the crazy right.
Let's not jump to assumptions.
Right. Very disappointing progressive.
Let me say this. The objection supposedly is that it doesn't do enough to control costs. And you have to ask, what more realistically could you expect? I know David praised Atul Gawande, one article of his. There was a later one, a recent one, which said, look, they are in fact trying everything that people have suggested in the form of a pilot program. There's a whole list of things that we think might control costs. This is going to be in the legislation. It's something that's going to be tried. This is the first serious attempt we've made to control healthcare costs. And by doing that, it actually proves something that people like me, advocates of universal coverage, have been saying, which is that the only way to control costs is as part of a package that also covers the uninsured. That you're not going to be able to just go and say to people, okay, we're going to take away some of your health care. You're going to have to go to them and say, this is what we need to do in order to provide health security to everybody. And this is a landmark piece of legislation, flawed, annoying, underfunded. Lots of things are wrong with it. I wish there was a public option. I wish there were lots of things in there. But this is the most dramatic move towards getting rational about healthcare spending at the same time that it finally fills at least a good part of the hole in our system, the holes in our safety net. So,
Listen, I don't oppose it because I want to step on the necks of the poor, as you could say. I oppose it, and it's a close call for me, because we used to spend 10% of healthcare, of our GNP on healthcare. Now it's 17. Soon it'll be 20, 22. More on healthcare, less on education, less on infrastructure, less on investment, less on everything else. This bill will do absolutely nothing. It will slightly increase the amount of money we spend on healthcare. So what could you do politically to do something about that? Well, I wouldn't mind a single payer. Frankly, I prefer a single payer to what we have now, because that actually would control costs. My preferred option, though, would be to give consumers choice. There are health economists, Alan Eindhoven. There was a bill called the Wyden-Bennett bill, and people said, oh, it's politically impossible. Well, this bill right now, in the NBC Wall Street Journal poll, has 32% support. I think I could get 32% support for some consumer-related bill that would give
healthcare polling. I think this is actually important. A fair number of the people who say they don't support it wanted something stronger, wanted something more aggressive, so that doesn't break down that way. And if you ask people about specific provisions, by and large, they get public support. I know the example of Massachusetts. This is kind of a Massachusetts-type program for the United States, better than a Massachusetts program, but along those lines. If you ask people, do you approve of now that they have it in Massachusetts, do you approve of it? It's not very favorable. If you ask people, do you want to get rid of it, or do you want to maintain it and perhaps extend it? Overwhelming support. 79% of the Massachusetts public wants the program to continue. I think that's the way this is going to work. This bill is going to be, people will complain, they'll say, oh, this isn't what I want, this isn't good. You'll ask, do you want to go back on it? And overwhelmingly, they'll say no.